County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Nurse show, living a longer and healthier life. Normally we have doctors on here, but tonight we have a nurse, so I kind of changed it up there. I'm really glad to have on the program Amy Seigel. Like I said, she's a registered nurse, director of care management at Advocare, Care Advocates, which we're going to learn a lot about tonight on the program. They are a Advocare group in Palm Beach, Broward, and Miami-Dade counties, so across South Florida. And without further ado, I want to introduce Amy Seigel. She's RN, CRRN, CCM, which I'm going to ask you all about in a second. But thank you for joining me on the program. How are you doing this evening? Great.
Thank you for having me.
And thanks for coming along on this adventure of health. So I wanted to ask you a little bit about Advocare, Care Advocates, because I know you've been around for a while, but I haven't had a chance to learn too much about the company. Great website. What does your company do, and how do you help people in South Florida with health care?
Hi, thank you for having me. I am super proud of Advocare because of the team that works with me every day. We're one of the first organizations down here in South Florida comprised of nurses to help families navigate the healthcare system, facilitate the healthcare system for their parents that are down here, and work out all the details that come into taking care of a loved one when family members might not be right here. We also have a fabulous team of non-medical care managers and social workers and life care planners that have done some amazing, incredible plans with families on how to take the finances and the insurance and all the resources and craft that together with the nursing health care plan so that families can really work together to be safe and stay in the environment that they want to live in as long as possible. So we get very involved with the specifics of families and what their goals are.
That's so important because it can be a job in itself, looking after a loved one or, elder services. I want to ask you, years ago in the industry, it was called geriatric care managers. Yeah. Tell us a little bit of how that term has changed today.
So, yes, when this first became an industry, it was termed geriatric care manager. And that was the branding, and that was what people knew of it as. And about 15 years ago, Advocare's clients, we started obtaining, working with families that had people that were in their 50s with maybe a chronic illness such as MS or Parkinson's disease. And these people weren't necessarily elderly. They just needed support in handling their health issues. And those people certainly didn't want to be called geriatric. And so way back then, I immediately changed all, my information, all my marketing material to, a nurse advocate, a care advocate, a health care coach, because people did not want to be called geriatric. And then finally, our national association, it was called the National Association of Geriatric Care Managers, and it's worldwide. It's we have care managers in all different states, and it's our national credentialing organization. And I should say that that's very important when you're looking for a care manager, there are many people that do different types of work in this industry, but if you would like a credentialed, and the credentialing process is very strict through this association, that would be right now it is called the Aging Life Care Association. So the whole entire organization rebranded from the National Association of Geriatric Care Managers to the Aging Life Care Association. It's called ALCA, ALCA. And those people that are in that organization have been granted the credential through a strict process of educational requirements, continuing education, years in the industry, and extensive testing. And
so just like, I interview a lot of doctors on this show normally, and just like a doctor has to get credentialed when they come to a new hospital or new healthcare network, the nurses that you're working with and the aging care specialists get credentialed as well.
Absolutely. Our team is comprised of nurses that have many, many years of experience, all in the industry of healthcare and working with chronic disease or older adults. We have a team of social workers, and our life care planning department are all credentialed and certified to do this work. They've been doing it a long time. So.
And I got to share with everyone on the website caremanage.com. A ton of great information there. I have to tell you that.
Thank you.
There's also profiles for all the nurses and life care managers on there. So actually, the photos are really done well. There's even some pretty in-depth bios there as well of the actual education and training that some of these employees with your organization went through. So that's great. And then it even has the area that they cover. I'm looking on there, Delray, Boca, Boynton Beach. I just think that's great to have on there because it really shows, the level of expertise and care that Advocare provides. And to give that, I think I counted there were like 23 of them or 25 of them or something.
Well,
that's great.
Yeah, there's over 20 team members, and the most important thing in care management is that you know your client really well. If I like to look at how we built this organization is based on how we would want to treat our own parents. So if I was living in another state and my parent or parents were down here in Boca Raton or Boynton or in Miami, I would want to know that I had somebody that I could count on that knew my mother and father's situation socially, emotionally, mentally, functionally, and could be on call 24/7. And so that is why we have the territories, David, because we want to make sure that our care managers know each person is assigned their own personal concierge care manager, whether it be a medical case or a transition case, and I'll explain a little bit later what that means. But we want to be close to our clients. So if we're working with a client in, Palm Beach County, we want to know the best doctors to take that person to in that area, the best specialists. We have to look for the right specialists, and we want to be close to those clients. We want to be able to know that if we get an emergency call, as sometimes we do on a weekend or 11:30 at night, somebody's fallen and we have to go to the emergency room with our chart. We want to know that we're not too far away. So that's the significance of being close by, and it's really comforting to the out-of-town family.
Most definitely, and then you can help their loved ones navigate through that process.
Correct.
You mentioned fall, and we talk a lot about, as the baby boomer population is growing, and then even beyond, they're saying baby boomers is the largest population group in the U.S.
That's true.
And my parents are baby boomers. They're starting to get a little older, and then even beyond that. And you mentioned fall, and I know that a fall when you're younger, it doesn't sound like too much, but it can cause or start to cause a whole bunch of different kind of ailments and problems. Is that what you see a lot of, or I mentioned before the program dementia, which early onset dementia is something that I've read a lot about lately, and it's happening people sometimes even in their 50s. I know there was a famous women's basketball coach who passed away a few years ago. Are you seeing a lot of need for care from falls, dementia, neurological disorders, or what kind of kind of give us a little bit of the ailments that you're seeing.
Okay, so we really see everything. We see a vast array of diagnoses, and we are working quite a bit with the older population. So you're going to see different types of cognitive declines. Some of our clients do have the Alzheimer's diagnosis. There are some clients that have another type of memory disorder. Some people have, a disorder that is a Parkinson's type disorder that also presents itself with some cognitive difficulties. And so you have to really understand that there's not one type of this kind of disorder. There's many different types, and you have to be really diligent at finding the right specialist to diagnose that, so that you can help these families work on how to help their family member, how to treat these people. So people come to us sometimes with so much question. They've been to different doctors, their parents have gone all around trying to help themselves, but they're really not finding the right answers. So we pride ourselves in trying to help these families find the right doctors, to get to the right practitioners, to get to the right diagnosis, so that you can come up with the best treatment plan. To go back to your question, we're dealing with, we have had clients that have early, onset dementia, Alzheimer's, okay? But there's ways to prolong the progression of those diseases if you can. We try our best to work with families on how to keep people as independent as possible. Sometimes you can't change a diagnosis, but you can delay secondary things from happening, such as falls, such as creating a safe home environment. We have our transition and life care planning department. We go in, we can do very thorough safety assessments where we can look at a room, look at a bathroom, look at a kitchen, and say, wow, these two people want to stay in this home as long as possible. And we bring in, the right contractors to make sure that everything is set up in that home so that they can stay. It's all about what the family wants, what the client wants. And sometimes it doesn't take a huge amount of money to recreate an environment that's safe, that's easier. Sometimes, we're all dealing with, people getting older, and nobody wants to admit, I can't get to, that area of my closet. And they pride themselves in being able to do things, but we don't want people to climb on a stool or in an unstable situation to get to something. So we actually, once we get to know our clients, they share with us, they show us, and we try our best to help keep them safe. We have an active aging program, which we are very proud of. When people are done with their formal physical therapy and they still have more time until their therapy is going to restart, maybe for the new Medicare season, but they want to remain in shape, they want to have their muscle tone, continue to be flexible. We have a program. We can come in, we can help them, do their workouts. We have trainers that can make sure that they are walking, that they are breathing well, that they are doing some exercise. That all helps people feel better. It helps their mental status. So we do those kinds of things too. We like to say, we're working on the whole situation of somebody aging, and we don't necessarily just focus on disease and, negativity. We try to focus on, okay, this has happened, but we're also going to work on, getting to what's working and expounding and creating things in their life that they love, that they can still, enjoy.
I'm going to put a little tag on that. Safe modifications and quality of life initiatives. We're here with Amy Seigel, RN, Director of Care Management at Advocare Care Advocates. Hold that thought, Amy. We're going to take a quick commercial break, and on the other side, talk about medical case versus transition cases on the show.
Thank you.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and welcome back. We're here with Amy Seigel, RN, CRRN, CCM, Director of Care Management at Advocare Care Advocates. The website is caremanage.com. Great website.
Thank you.
That's where I did my research for the show.
Thank you.
And you only got rid of 2 of my questions, so I think I did pretty good. So your care managers, they're standing by to help you. They conquer that feeling of being overwhelmed with their care, assess their situation, and provide you with an immediate plan and advocacy, manage all those disparate pieces of our fractured medical care system, orchestrate their care, allowing you to make the most of your precious time with them, make your life better by making your loved one's life better. And you can learn how Advocare can help you. So, like I said before, there's profiles on your website, and you can see, I think I counted there was like 25 different specialist aging care managers that you had on there, and there's different regions, as you said. Take us a little into a medical case versus a transition case, because I know you said that before, and I was kind of thinking, I don't know if I really know the difference. Is that coming out of the hospital or some kind of...
Okay, so that's a great question. As a certified care manager, you have to be able to enter a case, enter your work with a family wherever that person is. So sometimes we meet with a family and they're at home and they're doing very well in their home. They're getting to a certain point in their lives where just going to the groceries too much, and they're not able to socialize as much because their community is changing. And so they sometimes very calmly sit with us and talk to us about, if I were to make a change, can you talk to me about what types of communities are available? And can you talk to me about, I'm a card player and my wife is a golfer, or whatever. We want to focus on the best communities. Our transition care managers focus on what are the needs of the client and what are the things that they like to do. And you have to really know the person. And we do it in an in-person way. We don't send papers anywhere to a community. We are making sure when anybody under our watch or that hires us to help them and assist them in a transition, that they don't have to keep moving from place to place. We want to make it as seamless and as easy for them as possible. And so we have to get a lot of information. We have to get information about their likes. We have to get information about their habits, their social events that they like to attend. And also we have to understand their finances and what they can afford. There's no sense in showing somebody a community that is completely cost prohibited. So we're so lucky in South Florida because we have so many different communities and so many different price points and so many different styles and room types and activities that really there is so much choice. We're very fortunate here in South Florida because of that. And then, of course, there are communities, David, that focus on memory. There's communities that focus on active lifestyles. There's communities that, focus on it very much of an independent living community. So it's really based on what that family needs. And to the other part of what we do is, again, stepping in where we're needed. So sometimes we get a case where a family's calling us from another city and they're saying, Amy, please help. My mother's had her 3rd hospitalization in the last 2 months. And every time she gets home and gets settled in her home, 2 days later she goes back and that's really a problem for the families because they're out of town. They're unable to keep flying down, and once they do get down here, all they're doing is running around trying to put the pieces of a puzzle back together that they really don't know where to start. So they hire us. At that point, we do have to walk into this case, and it is in a crisis. Well, so we will go wherever that client is. If they're in the hospital, we will go and start the case there. If they're in a skilled nursing and rehab or need to find the best skilled nursing and rehab, we will go there. We will go to anywhere they are and figure out where you're at, what is going on, and how can we help. We have to be, I call my team, medical investigators. We have to find, why are they entering into this hospital and through the ER every 2 days? What's going on? What's wrong? What's not working? Are they taking their medications incorrectly? Are they not getting the doctor's information as clear enough? Has there not been enough follow-up based on the last discharge? So we're trying to get all this information and then put it together in some kind of a way that we understand what has happened in the past and how we're going to change it for the future. And it takes a lot of times. It takes us doing our work and the family working with us. Even if they're long distance, their parents are very comforted knowing that they've hired us and we can work together to create a safer plan. So the medical team often has to interface with the transition team because when we have our client medically stable, sometimes they're not able to go back home for whatever reason. They need a hiatus in a rehab or a place where they can recover a little bit longer. And so then we have to work with our transition team to make sure that they are going to be in an environment that they can continue to recover. And eventually, whatever their goal is our goal. We are not here to do what we think should be done with a family or a client. We are here to help them with their goals in the safest and healthiest way possible. If there's something that can't be done, and it's just not a reasonable, option, we'll explain to the family and that client why. But we always try to really consider the feelings of the person.
Well, I'm told you're the best in the industry, and you've just shared a ton of knowledge.
Thank you.
And this is coming from a peer of yours in the healthcare industry as well. So tell us a little bit how many years of experience. You're welcome. You deserve it. How many years experience do you have in this field? Okay.
Well, I graduated nursing school in 1984. So I'm dating myself.
I saw Michael Jackson on the Thriller tour in 1984.
I'm one of those baby boomers that you were talking about. There you go.
Yeah, true story. I was 7.
Wow.
I still remember.
Wow. Yeah.
But no, that was a great year.
So So I've been a nurse for a long time, but Advocare was born 18 years ago after I'd worked for years in the hospital environments, actually clinically with patients. I was one of the first nurses. I'm fortunate to be asked to take the certified, one of those initials is the certified case management exam.
Thank you. I was going to ask you that.
I was the second group of nurses to take that exam back in the early 90s, if you will. And that allowed me to become very instrumental working in the hospital with families doing discharge planning. Back then it was called discharge planning. And there was a select few of us in these hospitals that did this work. And then after many years of working in the hospitals and in the facilities, which was great and wonderful experience, I like to say a coconut dropped on my head in the hospital parking lot, and because families were actually asking me, can you please help me? I have to go back to New York City. I have to, the sister, I have to go to California. I can't stay down here and wait for my mother to completely recover, but we trust you. We need your advice. What are the best doctors? What are the best rehab facilities? Can you help us? And so I like to say this work came to me.
Mm-hmm. Do you have to have a passion to do this type of work? Because I see, the passion just comes off of you. Really, no, I'm being honest. Do you have to have a type passion?
Well, I can just tell you that all the people that work in my organization are passionate about what they do. And yes, to answer your question, I believe you have to be passionate about helping people and doing the right thing. and always doing the right thing. Sometimes it is hard to do this. It is never easy to do this type of work because you're dealing with families, you're dealing with emotions, you're dealing with aging issues, you're dealing with life changes, you're dealing with crisis. You're dealing with a lot of intense emotions and situations. And if you're not passionate about helping people and coming from the right place, it just doesn't go that well. So yes, you have to really care about what you're doing.
And again, it's Amy Seigel, Director of Care Management, Advocare, Advocates, CareManage.com. We got about 30 seconds. If people want to find out more about insurances, if you take Medicare, they can call the number 561-266-3489.
Yes, I just this service is covered not by Medicare, unfortunately.
Oh, okay.
It's covered by private pay, long-term care, or veterans benefits. We also have a sister company that helps veterans. We have a private duty company called One Call. And yes.
Thank you. It's caremanage.com.
www.caremanage.com, and we welcome anybody that wants to call.
Right, thank you for the interview. I appreciate it.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.